We already have one patient in our ward under observation, which is why we are not allowing any media and public inside the facility as at now. This patient is a patient who traveled to Mandera from Nairobi 2 days ago, and at the screening level at the airstrip, it was observed that he had a very high temperature of 39 degrees, and which prompted the health personnel at the airstrip to pick him up and admit him at the isolation ward. Samples from this patient has been sent to Nairobi. As at now, other than the high fever, the medical personnel have not reported any other signs that conform to COVID-19. However, because we are not going to take chances, this patient is under isolation and is getting managed at the hospital as we wait for the test result from Nairobi. I can confidently say we have infrastructure in place, but we require support in terms of additional beds, ventilators, PPEs, patient monitors, and most importantly, health workers. These ICU and HDU require consultant physicians and more nurses to help contain the spread of the coronavirus. We also have a major gap, which is also not only applicable to Mandera, however, to many counties, and that is lack of testing capacity to be able to identify whether or not even patients that we suspect are COVID-19 patients. As such, the nearest testing facility is 1,200 kilometers, that is in Nairobi, as advised by National Response Team. And the turnaround time takes quite a bit of time. It poses quite a lot of challenge for us. And we hope as the challenge is seen real and the numbers increasing, testing facilities and testing capacity for areas far-flung like this, which are counties that are closely bordered with Somalia, which does not have capacity to respond effectively along our border, up to a radius of 400 to 500 kilometers, as well as southern Ethiopia, which closely borders us with about the same radius without proper testing facility for the same. And both countries share more than 300 kilometer borderline with us in Mandera, and as such we have grave concerns with respect to control of movement that is cross-border. Since the start of our response measures, Mandera County health workers have screened 2,924 passengers who arrived by flight, 2,309 travelers who arrived by road, and 6,791 people at our internal border crossing points. We have fumigated 213 stalls in the market and 659 public areas within Mandera municipality. Some 2 samples have been sent to Nairobi, including the one I just mentioned. One of the tests have been confirmed to be negative, and the other one we're still waiting for the result, and that is of the patient that I just mentioned.